Un patient alité qui n'a plus besoin des services intensifs que fournit l'hôpital peut être désigné comme ayant besoin d'un autre niveau de soins, ANS, et obtenir son congé ou être transféré adéquatement. La gestion des patients ayant besoin d'un ANS représente un défi pour le Canada, étant donné les longues listes d'attente pour les lits dans les établissements de soins de longue durée et l'insuffisance des services de soins à domicile dans la collectivité. Le Air-List de Mississauga-Halton a trouvé un moyen d'éviter les attentes grâce au programme Chez soi avant tout. Plus une philosophie qu'un programme, Chez soi avant tout permet aux patients de retourner à la maison au sein de leur famille.
We know that across the country, and in fact around the world, patients remaining in hospital after their acute stay is over is a problem and has been a problem for years. It was particularly acute here at the Mississauga-Halton area because we have a very low ratio of acute care beds, a very low ratio of long-term care beds per population. So access to our resources is very strained.
Between 2007 and 2008, the number of patients waiting in the hospital for long-term care almost doubled. And so our ALC patient days went from about 9.3 to 17.5. And as we closed 2008, we had 87 patients waiting for long-term care in our acute care beds.
The average wait for a home in Oakville, they've got lengthy wait lists, is 3 to 5 years. They would be here for 3 to 5 years. Well, that's just not possible.
So we knew we needed to do something different. On a daily basis, we were having multiple bed meetings with our management team and our emerge team, looking at how we were going to accommodate those patients in our emergency department who were admitted and needed a bed.
The lightning bolt moment, or the aha moment, was when I was with the LHIN looking at all the investments they had done in the community through the Aging at Home strategy, yet the ALC rates hadn't gone down, and there really didn't seem to be a reason. So when I started to look at the process with some of the partners, we went, you know what, we're not providing the opportunity to evaluate the patients against the services. It was almost like a conveyor belt. We were doing things out of the wrong, in the wrong order.
The long-term care process is really quite a social process. It's about making very important longer-term decisions about where you're going to live and perhaps spend your last days. And doing that from an acute care bed in an acute care setting, we felt really wasn't in the best interest of patients.
Home First really became a philosophy for us because what had crept into place was the notion that if somebody came into hospital, then a very early determination was made that they should go to long-term care. And no matter how you looked at it, we weren't going to be able to provide enough long-term care places for that to be people's first choice.
So evidence suggests that those patients, once their acute phase is over, should be moved to the most appropriate location. And so it's an evidence-based philosophy that gets patients to the right place of care at the right time.
Our physicians had to understand that, you know, there could be a better, safer place for these patients to be cared for at home in the community with the right supports.
We actually wrote scripts for the physicians to use at the bedside that really said, you know, your acute length of stay in hospital is over, and the healthcare team is now going to work with you on a safe plan to get you home. And once they had that script, they felt more confident in delivering that message. And patients really do listen to their physicians, and so having their buy-in in this philosophy was really key.
Les partenaires de Chez soi avant tout reçoivent régulièrement des visites de préposés aux services de soutien à la personne, lesquels offrent des soins et donnent des pauses aux membres de la famille afin d'éviter que les soignants ne s'épuisent. Nous avons demandé à 3 familles la raison pour laquelle Chez soi avant tout était l'option qui leur convenait le mieux.
Without this help, no, I would be because that gives you some time for yourself.
Even with such a busy schedule, we know that our mind is at ease that there is someone coming and taking care. So I would always advise, if you have this kind of support given to you, then you might as well have your family or whoever is sick stay home and, you know, be comfortable at home.
In hospital, everything was perfect. Physical care, amazing. But there was no psychological and emotional link. And if your mind and heart is not in there, you can do better. So he wanted to go back home where he can do the little things, everyday things in better way.
So many patients, about 30% of people actually get better, improve when they're at home, and many of them can defer or delay the need for long-term care altogether.
Well, what we're seeing is that by continuing to look at community dollars, investing in the Supports for Daily Living program, the CCAC's Service Maximum programs, and adult daycare programs, home bathing programs, all of these things that together constitute the supports that a community needs to then support a home-first philosophy. We're seeing it as highly sustainable. It costs us less to do it this way than it would be to adopt the alternative, which is to have a much greater reliance on long-term care homes.
What's always nice is after the journey that we've taken with many patients and their families, the phone calls back and the letters back that say, you know what, we know it was tough, but thank you so much. Things worked out really well. Mom is getting up and walking to the bathroom, and she never did that in the hospital. Those little stories make you know that you've made a difference, that we are on the right track. It's not an easy track, but it is the right track to get people out of hospital and not waiting here and being able to make some good choices. And those are really important.
It's a blessing because every time, whatever time I spend with him, I'm making my good memories.